Greetings, my name is Dumiso. I'm from Success Capital Organization, and today in episode 2 on our road to UHC dialogue series, we are hosted by the Friends of Diversity organization, and hopefully we will have one of our other stakeholders join in, but we also do have a representative from TeenWise and YouthWise. I don't know why I keep saying TeenWise. So nonetheless, I am going to ask for some short introductions from the both of you, and then maybe if you could also just give a little bit of a background, 1 or 2 sentences in terms of the institutions that you're affiliated with at the moment. So Bonnie, please take it away.
Okay, thank you very much, Dumi. My name is Bonnie Sapora. I'm based here in Botswana, in Gaborone. So I work with the organization called Friends of Diversity, but I also work with the Institute of Development Management on public health. So I primarily work on human rights issues, trying to blend in human rights within and public health. And I'll give the floor to my colleague Gideon.
Evening. Thank you so much for having us. Thank you so much for having me. My name is Taban Gideon from YouthWise. I'm working as a health facilitator. My work based on increasing universal access to sexual and reproductive health services to the youth.
Great, thank you both so much for joining in. And I think it couldn't be more important at the moment in being able to discuss universal health coverage, and more importantly in our context, the right to health, knowing that it's not guaranteed in our country's constitution, and also given the fact that it is a milestone year with a high-level meeting on UHC marking 5 years since 2019's political declaration on universal health coverage. That being said, I guess the question is really to ask, from each of the different constituents that you work with, right? What would you say is the biggest challenge in terms of accessing health, and then more importantly, ensuring or encouraging health-seeking behavior? Maybe let's start with you, Gideon.
I would say the first challenges that we are getting is, lack of sexual commodities when it comes to increasing universal, health coverage. We need to have, everyone having to access the services at the available time, at the right place where they want it. But find that most youth, they find there's lack of sexual health commodities. So this is one of the challenges that we are faced in our country or in my constitution, that the youth cannot have the full right of universal health care coverage because there's a shortage in our country. And then also lack of trained, health providers. How can youth access these services when there's no one trained to specifically provide that services that they need, that the youth want? So lack of sexual commodities, one, and then lack of trained health providers, so who should provide those services. And one of the main challenges that we are facing, and other challenges that I would say is, inequalities in coverage. You will find that, in cities, you will find a lot can access their services, but those who are far from modern cities or to the proper health facilities, they cannot access those services. These are the 3 main challenges that I think they're affecting the achievement of universal healthcare coverage.
Thank you so much, Gideon. Bonnie? Bonnie, go ahead. What are the 3 main challenges? And then also in terms of acknowledging some of the shortcomings in health-seeking behavior with the constituents that you serve. Bonnie?
Yeah, maybe, just clarifying on the constituents that we serve. We primarily work with LGBTI people. So I would say the challenges surrounding accessibility, it's largely is the absence of commodities, especially STI prevention commodities. I'm talking about lubricants, I'm talking about finger cords, I'm talking about dental dams. You realize that some of these commodities are not available in our public health facilities. And if you don't have enough money to buy like lubricants at a pharmacy, then you'll not be able to access one because it's just not readily available. And then also there are issues around stigma, there are issues around just attitudes from some healthcare workers. You know, even though Botswana had decriminalized same-sexual activities in 2021, we still have pockets of discrimination in society. And the constituents that we serve, primarily being LGBTI people, they tend to have this fear of accessing health services simply because of the hostility, or just simply because of the stigma that is attached to their sexual orientation and gender identity and expression. So I think by far, even just looking at some services like hormonal treatment for trans folks or for transgender persons, if you not on medical aid, you'll not be able to access your hormones, you know. In any case, you have to go to like a private endocrinologist, which it's unfortunate for most of trans people, especially who are not working or who don't have the income or to pay for the services of an endocrinologist. They've even just buying those hormones in pharmacies. Yeah, I think that's that. And you still have this policies that are even somehow perpetuating stigma. Like I know at the moment, for you to change your gender marker, you have to like go through the court process, even though in the past we heard trans people who were able to change their gender markers, they had to go through the court process. And having to go to court process, we know that it's expensive, it's cumbersome, it's tiring. And then the aftermath of having to go through the court process, that while you are trying to change your gender marker, you are not able to be assisted fairly in healthcare facilities because of how you identify with, right? So your identity does not resonate the identity that is recorded on your official identity documents, which is also problematic. So yeah, when I talk about there's like, when you look at the Birth and Death Registration Act, for example, still limits trans people to change their gender marker, and I feel that it ought to be reviewed there and there. So I guess so those are just some of the things that I would say they are challenges surrounding accessibility to comprehensive healthcare services, for LGBTI people.
Thank you, Bonnie. And I think both of you had mentioned a lot of structural elements. And so I want to just bring it, to really context-specific issues. Gideon, so we understand, yes, that there will be shortages, commodity shortages. We understand that even sometimes service provider knowledge isn't most ideal. But what does it mean, or what does it look like for a young person, let's say, if there's a symptom and they might not be aware of that symptom, or if there's something that they feel like they're uncertain about, but they wait for the last moment. We know culturally a lot of people tend to only access health services in the worst of moments. So what would you say, particularly around young people, and what that means? Because a lot of young people aren't always, I guess, keen on going, if there's an issue and trying to get attention, cost aside, knowledge aside, the reality is that, demand creation for many community health organizations is a factor, particularly because of the challenge of health-seeking behavior. So what would you say, particularly, for young people, and maybe if there is any distinction between, those in urban areas, bigger, cities, towns, and those in the more rural locations?
All right. Thank you so much. we found it very imperative to provide comprehensive sexuality education. That's one of the key preventative primary elements that we include to ensure universal sexual health coverage. Because you may find it's not everyone who will take their health as an not investing in their health. Some wait for the last moment for something to occur. That is when they will go to seek for medical attention. It's the challenge. Like you said, it is different from urban to rural areas. You might find some, they are aware, some may not be aware at all. And then this is the comprehensive sexuality education that we are intending to provide to the youth. And then now to those who are aware and not seeking the health attention or medical attention, you may find some that attitude comes in. Now being the predisposing factor to the health outcome, which might compromise their health, which may lead to a disease or diseases or STIs. Let me take an example. If it's an STI, they may say, I don't believe it's an STI. Let me just wait here. Without even going to seek help from the health facilities. And then at the end, they will come now when their health state is compromised. So with that, with you guys, we're not only targeting to those who are around urban areas, even to those in rural areas. And then we realize that most of the youth, they're into social media. They're in the TikTok, Facebook, you always find the youth there. This is one of our key components where we will provide the comprehensive sexuality education. We are saying if someone cannot come to Youthwise clinic, where can they find this information about these health problems, about contraceptives, about this and that? So we are really winning on ensuring that even those who are not around our clinic, they can access this information. Yes.
Important is that, especially when we talk about something like UHC, you find that normally, primary healthcare in itself does not always speak to SRHR. And I think we've seen that SRHR wasn't prioritized during the COVID pandemic and during lockdowns and so forth. And so the question is, how can we make sure that not just SRHR, because remember, I think, a lot of people, we know that health is not the absence of disease, right? And I think for us to encourage even the country strategies around non-communicable diseases, things that we know aren't always really part of, if I can say, knowledge creation, IEC material targeted at young people. How can we make sure that young people are not just reduced to sex, they're not just reduced to HIV, they're not just reduced to SRHR, acknowledging, yes, that there are significant population development issues on those elements. But I think now the question really is, how do we encourage more young people, towards NCDs, towards cervical cancer screenings, towards, many other facets of health, mental health, and all these other sort of elements that, we never really factor in conventional development programming or in conventional civil society work.
Yes. It's very important to pinpoint what we have just said, that, even when we say primary health care is, when care is, accessible to everyone, and then there are the elements that, were not included, like you mentioned, SRH. But for us to realize universal healthcare coverage, primary healthcare is the foundation where everyone has access to health. Now getting to the term health, where it's a complete state of the mental, physical, and social well-being, not merely the absence of disease or infirmity. It's very important so that we bring young people to realize, the importance of their health, or realizing why is it important for me as an individual, for me as a young person, to really invest in my health. They say health is wealth. Because if we don't do that, we are going to see young people perishing because of this, preventable diseases. When we call young people to say, come for STI screening, come for cervical cancer screening, they say, that's for the old. The older they feel like, no, I'm too young. I don't feel like I might have it at my younger age. Now that's why it's very important to deal with, the predisposing factors before we get into the enabling factors. Sometimes the services are there. Now the youth are the ones who are not going to access those services. So the main key factor now you'll find it is these predisposing factors of knowledge, attitude, beliefs towards a certain health issue or a health problem. When we can address those, that is now where we can say, you know what, we tried and then we failed. Not only based on that, you know what, the services are not there. Taking from an individual perspective, I would say, if they say a health services that is, free and available to everyone, it's an individual's responsibility to take care of themselves, to go to that to access that health services. And then that is why now we are focusing more on the youth as youth-wise. To say, youth, you can take control and improve your health only if you do this. This is also where we bring determinants of health to the youth. To say, these are the factors that can influence your health. So when the youth are given this key concept into health, they can easily and manage to access those health services. It's not good to find youth not accessing the available services. For example, when we get to the concept of mental health, you will find that many youth are not accessing the mental health or the psychological services, but they are available. Looking at the current state now, we are losing young people because of issues like suicide. You will find that this root causes is the mental health problems that could have been avoided or prevented if they will come outside to say, as Gideon, this is what I'm going through. So it's also a very imperative to touch these predisposing factors to young people's health, to say, if you don't do this, this will affect your health this way. But thank you.
Thank you so much, Gideon. And I think, on that note, Boni, what would you say, given all these different determinants and I guess different multiple faceted health issues, how can we sort of encourage an improved way where someone now, if they do have health-seeking behavior, can be able to access whatever service that they need in whatever facility that they're in? We know right now that when someone is referred, that means they have to, connect with transport and go somewhere else. We know that there are many instances where maybe a specialist is needed, and that means they need to be referred. And when they're referred, that appointment is only ready maybe a month down the line, when they need treatment immediately after diagnosis and so forth. So I think the question then really is healthcare in Botswana really universal? Am I able to access each and every service that I need? Do we feel like whichever health practitioner that I face, that they are equipped to provide the appropriate care, whether it's mental, whether it's physical, in being able to accommodate my needs, whether I am someone, with a disability, or whether I'm part of from the queer community, or if I'm a sex worker? Boni?
Okay, thank you very much. I think we need to look at our just our healthcare service delivery. I think there's a lot to do in terms of building capacities around improving the healthcare service delivery. And then also, I think you've also highlighted a very important point that we need to consider. I mean, when we design interventions, we need to factor in what you call the primary dimensions of diversity and also secondary dimensions of diversity. And then really see or really ensure that people are able to access equitable healthcare regardless of the geographic location or regardless of the gender identity or ethnicity whatsoever. So I think that, I mean, in rural places or areas, you realize that you essentially have a health post, and that health post, there'll just be one nurse there. And some services obviously may not be provided at that level. So that means that you still have to, a nurse still have to refer a client maybe to a clinic somewhere. And chances are that people may not have adequate financial means to access like a hospital in another area. Maybe perhaps we need to look into our healthcare service delivery and see how we can incorporate e-health in our programming. I know that Botswana had the Ministry of Health in the past have developed an e-health strategy. And this is, I think, a wake-up call for service providers to consider improving or adopting telemedicine. I feel that, I mean, now we are living in a digital era, and I'm thinking that there are some avenues that we can utilize. And then obviously that would also present challenges regarding literacy, knowing how to even use these technological devices, but or even just improving the infrastructure and communication infrastructure. But those are some of the things that I think we can look into. And then, of course, we can just try to ensure that we also ensure that even our health posts in various villages around the country, we are able to ensure that we have the services, right? They may not be at the same level as the service that you get for Princess Marina, but I think we need to build some capacities there, you know. I guess also even just making the environment, just making it conducive for people to access, because sometimes it's not just issue of resources only, but it's just issue of creating a conducive environment for people to access services. And I think also we need to intensify the awareness or community awareness raising initiatives. And I think this is where the civil society come into place to ensure that we not only do programming in urban areas, but we also do extensive work in very remote areas. Because I think that some of the initiatives that we are can be spearheaded by civil society organizations. So I think that yeah, those are just some of the things that we can look into. Yeah.
Thank you so much, Bonnie. So Gideon, just to shift gears a bit, what are top 3 recommendations that you would say are needed, particularly when we know in instances of GBV, and that GBV can have an impact on SRHR, GBV can have an impact in terms of how people can access health, especially, in instances where we know that you need to get health services, outside your locale, outside your village, because maybe you only have a health post that's available. And then, the police station is 7 kilometers away. So what would you recommend as, 3 top recommendations to ensure that that one person who's left behind is able to to access health services at the most minimum cost, with the most minimum inconvenience, what would you say are the top 3 recommendations that you'd make to the government?
All right. The first one, I'll take it from the challenge that Bonnie raised here, of where an individual has to travel from other facility to access services from far facility. We want to improve financial protection, health financial protection. We don't want people to use their pocket money to go and access services very far. That should be within the 5 kilometer where they are. And then to gender-based violence, I will say, Botswana is placed around first or second when it comes to gender-based violence cases. But where is the root cause? My recommendation to that, I would say, because the number says men are the most perpetrators to gender-based violence, I say empower young boys and men in gender-based violence issues. Secondly, include them into the gender-based violence programs so that now they can put what they have learned into action. Also, the last one, I would say, let us put theoretical work into action. We might have, the code writing as the country and the health system, or this is what we intend to do. But at the ground, you will find that it is not actually happening what was intended to achieve. I would say put our primary health care into practice, and then it will lead us to universal health care coverage. Because if primary health care is not achieved, there's no way the country will achieve universal healthcare coverage at the full potential. Yes.
Great, thank you so much. Bonnie, what are your top 3 recommendations? And let's say, for individuals that don't have money, individuals that have, different vulnerabilities, knowing full well that their shortcomings with, a lack of effective and meaningful mental health, palliative care infrastructure, not accessible, facilities, and then more importantly, knowing full well that, there's so many different disaggregated approaches to health at a district level, which can be good on one end, but I think we know that because certain elements are centralized, that makes it a little bit more difficult to ensure community-centric and community-effective healthcare. So what are the top 3 recommendations that you would have in improving and fulfilling the right to health?
So I think the first recommendation would be when we design interventions for marginalized populations, we have to use a people-centered approach. I think that's really number one. It's really critical to ensure that people who are affected, they are consulted, they are part of the solution, right? I think the solution, instead of thinking for people, they need to inform the programmers. And I think secondly also is to really increase resources, ensuring that resources are availed. It can be ensuring that the programs that are trying to reach out to vulnerable groups in very remote areas, they have to be supported, they have to be funded. And then I think thirdly, it would be ensuring that we intensify the implementations of some relevant policies. And in that line, I would say that we are aware that the Constitution of Botswana is currently undergoing review. And there's been a push to ensure that the Constitution recognize the social, economic, and cultural rights. And the right to health as a social and economic cultural right, we know that is not yet recognized by our constitution. So I think also we need to hold the government accountable to ensure that such category of rights are recognized by the constitution as well. Okay, so I think by far that would be the three recommendations that come to my mind, right? Yeah.
Thank you so much both for your contributions. And I think, yeah, this is a critical time, especially because we know that there's significant shortcomings and that there's a hope for not only increasing resources as alluded to, but for ensuring that, whether it's someone Gomatengwane, whether it's someone Kukachikau, they're able to receive the same services as in Molepololelo, Batse, Gaborone. And I think, ultimately, the onus in terms of not only increasing awareness and accountability doesn't just lie with the state, but also with civil society. And so I think maybe it would be good to close off, with maybe, some recommendations, or maybe rather, what is a key action that you believe that civil society should take up to not only galvanize communities, civil society, and different constituents towards understanding the importance of a commitment such as a political declaration on UHC, but more importantly, to actually challenge some of the leaders that they elect to say, allocate more towards the state budget. Can we ensure that there is some form of transparency when you are there presenting certain bills? Can we ensure that there is justice when you're reviewing the through the Parliamentary Accounts Committee? What does it mean for a women's caucus or the caucus on HIV and health? Those different sort of mechanisms that are there to ensure that our interests are actually represented. So I guess maybe it's just a parting shot in terms of tangible actions that you believe that civil society within our communities and beyond can be able to take up the mantle to encourage accountability towards UHC. So maybe let's start with you, Bonnie. What would you say is a tangible action that civil society can take up to ensure, okay, Gideon, maybe go ahead with tangible action that civil society can take up as a recommendation.
Yes, I would say they should have full responsibility towards health. Let it not make it a responsibility for those who are at the policy making stage. Even at the communities, let them make sure that they are taking the responsibility of their health, from individual, family to the community. Because from an individual perspective, if I get to know my rights, towards health, I should challenge those who are leading the health system. And also, you mentioned the part of those who are in the leadership position, from the ministry, and then even from the HOSI. We have to say, speak for us, because the gatekeepers, they're the ones that people trust them, that if they speak for them, their concern will be heard. So I would say they should take health make it their responsibility. That's the thing that I would recommend to the civil society, because we cannot wait to say Minister of Health is the only one or the Minister of Health is the only one who will provide the solutions. So we also give people enough training. If they have enough training, they could utilize the available health resources in a meaningful way that they will benefit their health. That is the role of one of the roles that civil society can play.
Thank you so much, Gideon. I really appreciate it. I see Bonnie has connected again the challenges of technology. And I guess more importantly, give us, those closing remarks, Bonnie, in terms of, what is key for civil society to take action in terms of encouraging accountability, transparency, and civic action around mobilizing for universal health coverage.
Thank you very much. I would say the civil society should consider that principle of saying nothing for us without us. And I think this is really key to ensure that, civil society is doing so much work. But I think there is a great need to ensure that the people who are the most affected, they are empowered to lead the process. So I think as we are talking universal healthcare coverage and what the civil society can do, I think there's really power. Power it's among the people who are affected. So obviously the civil society has to amplify the voice of the marginalized, has to ensure that issues of transparency, issues of really accountability, creating that platform for the affected people, the communities that we work with, really creating a platform for them to share their concerns, for them to share their ideas. I think there's so much creativity that will come from engaging the communities themselves. So I think that's what I would say in terms of the civil society, and really working with the government, because I think the civil society is not there to fight with the government, but really creating more strategic partnerships with the government, because at the end of the day, we are doing this work because we want to improve our healthcare system. And we cannot do it on our own as civil society organizations. And we can't do it if we fight the government. So we have to find alternative strategic ways of working with the government, right? And I think also the civil society, because you realize most of the civil society is supported by international donors. And it's very unfortunate that now Botswana is an upper middle income country. And that means most of the resources are taken away. We are not able to qualify for international aid because of our income status. So that calls for civil society organizations to also come up with creative resource mobilization. So that's that. So there's, I think, also a need for civil society organizations to adopt a business model in terms of fundraising and resource mobilization. Yeah.
Great. Thank you so much, Bonnie, Friends of Diversity, Gideon from YouthWise. We had such an amazing dialogue, and hopefully this can be one of the many other steps that need to be taken in the long road to leaving no one behind in achieving universal health coverage by 2030.